Get started. Good evening, everyone. My name is Elizabeth Ward. I'm an Assistant Dean of Admission at Providence College and excited to welcome you to our webinar this evening, all about our School of Nursing and Health Sciences. I am joined by two wonderful members of the school itself, Dr. Kyle McGinnis and Morgan Rayner, who are here to give you a bit more of an introduction to the school itself and give you some of the updates that come along with this brand new, exciting opportunity at PC. Dr. Kyle McGinnis is the Senior Advisor to the President for Strategy and Planning and the inaugural Dean of the School of Nursing and Health Sciences. Prior to joining PC, he was the Provost at Johnson & Wales University and previously served as the Founding Dean of the School of Health Sciences at Merrimack College in Massachusetts. And Morgan Rayner is part of the Health Professions Advising Program, and working in collaboration with students and their academic advisors and the health professions advisor to make critical decisions that include course selection, engagement in extracurricular activities, exploration of research opportunities, and helping with one-on-one support throughout the application process for future opportunities for all of our students. They are here to, again, give that introduction to the School of Nursing and Health Sciences and answer all of your questions this evening. I'm here to help from the admission perspective. I'm going to turn it over to the two of you to give your presentation tonight. Students, if you use the Q&A function down at the bottom, I am happy to have all of those questions answered this evening, or feel free to use the chat as well, whichever is more comfortable for you. But without further ado, Dr. McGinnis, I will have you jump on in here. Let me just get the presentation up and ready.
Okay. Excellent. Good, Liz? All right. Well, welcome, students. It's wonderful to have you join us this evening. My name is Kyle McGinnis. As Liz said, I'm the Dean of the school, and we're excited to be able to share with you some of the things that are happening here in Providence, and hope you're having a great night wherever you are. This is going to be a fairly quick overview. We're happy to answer questions and that type of thing. The School of Nursing and Health Sciences is actually brand new. We have our first class here right now. I'm looking out the darkness here, but it is a beautiful night here in Providence. We have over 100 freshmen, about equal numbers of nursing and health sciences students. It's really a premier class in a world-class program. This program is getting national attention, and we'll just dive right in and kind of show you what's going on here. But you have to really, hopefully some of you have come to campus because you can feel the excitement of what's happening here in this program. So without further ado, let me take you through a few things, and then we'll turn it to Morgan and then answer your questions. So next slide, please, Liz. So the first thing before we dive into the actual school, if you don't know that much about PC, or maybe you've, like I said, have been to campus, it's an amazing place. I've been here for 2 years, but I've been in higher ed for 30 years. And this is one of the most friendly, welcoming, supportive environments you can find anywhere in the country, in any school. So we call it Friartown for the Friars. And Friartown is about being a family, and the level of support that we offer, and the level of welcoming and really just surrounding you with really everything that you need to be successful. And, I think, again, I really welcome the opportunity to meet you and come experience Friartown. It is just a very, very special place. One of the things that's really noted about PC is we have a nationally recognized liberal arts program. And if you're interested in studying nursing or health sciences, or I understand we might have a few students even in other majors with us, the liberal arts is really a great opportunity, because what it does is it helps you with skills like critical thinking and problem solving, and really just using your mind in a way that's going to be so beneficial as clinicians or researchers. And, I came from a state university system, and really when I got here, really got an appreciation for how integrated the healthcare into a liberal arts, what an advantage that is. So I really commend you for looking at PC, to have that opportunity to study in the liberal arts, along with all the things that you'll do in your major. We're also mission driven, Catholic Dominican institution, which means we're focused on service and care of others. And from a health standpoint, we're focused on a holistic approach to health. We believe mental health, physical health, spiritual health, that they're all connected in the person. And so our curriculum is really focused on getting people healthy and keeping them healthy through a holistic approach. And then finally, again, how I think we're a little bit different is our lens, the way we look at health, is really through a kind of global perspective. So we have a lot built into the curriculum around global and cultural immersion experiences. And again, you can have those experiences right down the street at where we work right in Providence, but you can also have opportunities to really have a global experience. And we'll talk a little bit about the places that our students are having that opportunity. Next slide, please. I said a little bit, why is this so exciting? I mentioned to you that we're just kicking off our first class now. Our second class are you guys. For most of you who are seniors, about 50 years ago, we had our first class of women on campus, and it historic, right? 107-year-old, really premier college. And it really wasn't until about 53 years ago we had our first class of women. That class really went down in history, right? They made history. You are that class. You are the initial kind of first couple of classes into a brand new school that has now a national recognition and reputation. So this is part of the excitement here. Our students want to be part of history. They want to actually be pioneers. And so again, I think when you come to campus, and if this ends up being the right match for you, you really are the pioneers who will be remembered as really initiating a brand new school here at Providence College, and what that will impact the region and its impact across the United States. So I give you a lot of credit for coming in and being bold and being courageous and coming into something that's a new program like this, because you're going to make a difference. Next slide, please. Regardless where you end up studying, hopefully it's with us, but regardless if, wherever you land, I really commend you also, and not to worry, you're entering a field which is by far the most advantageous choice you can make is to be in healthcare. The need is great. You see that on the news, and it continues to grow. So this is a slide that shows you the U.S. World News and Report, and healthcare dominates almost every position. I think we're in like 7 of the top 10 possible jobs you could have anywhere. Healthcare is really dominating. So I think you're in a great time to go into healthcare. There's tremendous different avenues you can choose, nursing being one of the top, but there's so many other things that our students are doing. And you can see some of the examples here, but there's many more. We'd have to fill up about 20 different slides to tell you everything that our students are in. Next slide, please. Just take a second here and just kind of show you how the school is organized. We have 2 academic departments, one on the left, a little darker gray, one on the right, a lighter gray. So the Department of Nursing, when we have all 4 classes, be about 350 students, which is a very modest size. I mean, compared to many of you who are so interested in this, we could be triple that size. We choose not to. This is a high touch, high attention, quality-based program. We are not really driving a program, for the masses of thousands of students in one school. So, and that makes, we feel like, sets us apart. So about 300 or more nursing students when all is said and done in each of the 4 classes total. So we're about 75 students in each class for nursing, and kind of the same thing on the health science side, although we have 2 programs there. A health policy and management, which really focuses on public health and epidemiology and the kind of where business and healthcare meet. Really exciting field. But then the health sciences, so I'm actually a health scientist. I worked in the Boston hospitals and did research and kind of exercise science, nutrition, heart disease prevention, kind of those areas, research. I ran a clinic at one of the medical centers. I worked at Children's Hospital in Boston. So my area wasn't nursing care. It was more really on the health promotion and rehabilitation side. So that's kind of how we look. We got kind of 2 sides of the house. We have our just incredible nursing program, and then we have a very exciting health science program. We're in the midst of starting all our graduate programs. So the time you guys get here, there'll be pathways directly if you wanted to stay and do graduate study here. That will be all set up as well. Next slide, please. These are some of the things that we're super excited about. You have a picture of some of our students right here. These look like a couple of our freshman nursing students. And Professor Brett Ely is showing them, that's an actual cadaver, one of the sections of a cadaver in one of the virtual anatomy tables we have called Anatomage. So look at the attention. I mean, our classes, we have 100 students in this anatomy class this semester, and no more than 15 in any individual. So they know the professor is right with them, really giving them a lot of attention, a lot of care. On the left side of the screen, if you just take a quick look, we offer some really unique courses. So most of you, regardless where you're going to go, you're probably going to take a chemistry course. You might take a microbiology course, that type of thing. We have worked with our faculty and other disciplines to create special so we offer chemistry for the health professional. You're not in a chemistry for the chemist class. We have a microbiology for the health professional, not microbiology for the biologist. And so we've tailored these courses to the health professional, put you on a pathway that regardless of which direction you want to move in, you've got everything you need to kind of go into, other areas, because all your prerequisites have been tailor-made for you. We're doing some things with our colleagues across the college. We just started a Spanish for health professions minor. We're very excited that our program is launching in Puerto Rico in May. So it's a 6-week cultural immersive program that we're offering. And again, one of the examples of how you might get to study in a kind of global manner. We have some centers and some research opportunities in the humanities. We have a program in medical theater. It's super exciting. We work with our theater arts department, and our students do actually role playing, like in Grey's Anatomy and that type of thing. You have an actor playing a patient. Well, our theater art students will be doing role playing and with whole character with costumes and everything, and they'll go through clinical examples, and our students will treat them just like they were a patient. So again, we're really integrated, not only in our own school, but how we're integrated kind of across Providence College, across the curriculum. We have tons of opportunities for you to do internships. Of course, if you're nursing, you're going to do about 750 hours of clinicals, and those will be both in simulation labs, as well as, I think we're in every single hospital, certainly through Rhode Island, but into Massachusetts, Connecticut, New York, and other places. So we have got a tremendous diverse clinical placement for the nurses, and I think we have well over 40 right now, and that's going to grow internship sites in health policy management and in the health sciences. So lots of opportunity for you if you're a very hands-on person, not only in our labs, but you're also going to be able to get out there and get some real great experiences in the field. And a lot of our students get hired right from their internship programs. So I think that's something, again, that's pretty unique that we offer. Next slide, please. I've talked about this, I won't go into detail, but we've got a lot of really wonderful global programs. Down the bottom, I'm pictured there with some of our students. We just went to London last May. We did a Global Health London program. Some of the students did internships while they were over there. And on the right is two of our faculty in Ponce, Puerto Rico, to set that program up when that's just a couple months away. We're setting our nursing director is setting up a program in Ghana with the hospital in West Africa, and yeah, lots of things that are going on. So we can talk more about that, if you come visit us. So we'll go to the next slide because I just want to watch my time here. So kind of the last thing for me before I hand it over to Morgan is we have world-class faculty. Wait till you meet them. They're so dedicated to students. We have faculty that have trained at Yale, at Harvard. We have a nursing faculty from Boston College. They're just a cream of the crop. We have world-class students. This is it's a selective program. It's really competitive. So the students who come are really, they're great students. We think that a world-class facility is the next missing piece. So we are building a world-class facility. I think by far this will be the premier nursing and health sciences center, certainly on the East Coast. I haven't seen a lot on the West Coast, but let me show you a couple of pictures and I'll hand it over to Morgan. So we'll go through, Liz, we'll just kind of click through a couple. This is the first one. I just want to show you this. So the the building is going to be complete. Let's see, you will be freshmen. Your fall semester will actually be here in the Feinstein building. We've renovated the space up in Feinstein, and your anatomy and physiology in the first semester will be here while we're completing the building of the other building. So that's this one, and then go to the next slide. So here's a shot of this picture. So this is the largest construction project in the 107-year history of Providence College. It's a big one. It's 5 stories, 125,000 square feet of programmable space. We have an entire simulation hospital on the 3rd floor. It's just going to be fabulous. Next slide, I'll just give you a feel for this. And that's the back side. You can see you're coming in on the Eaton Street entrance, and this is the back side, and you go around. We call it a building with 2 fronts. The back looks like a front, the front looks like a front. Here's some of the cool things inside. This is a human performance lab. So as I mentioned, I'm an exercise scientist, so I can work with athletes, I can work with patients through exercise. We're going to have a state-of-the-art human performance center. Here's a cafe. So you spend a lot of time in the building. It's a really nice place. You grab something to eat, a lot of social spaces. You can just keep going, Liz. We even put a chapel. Remember, I talked about spiritual health, mental health. We put a chapel in. We have put mindfulness suites in. This is actually, let's go back to this one last one. This is a picture of the one more forward, Liz. The other way. There we go. So this, if there were actually people standing behind this desk, it's literally a nurse's station constructed in the same way. And if you go through the double doors, there's all sorts of high fidelity mannequins and simulation and all sorts of these types of individual, from everything from labor and delivery room to med surg room to a pediatric even an outpatient type setting. So all of that, the idea is that we want to get you on the nursing side, get you all of these experiences prior to you going out in clinical. But then when you're in clinical, you might see something that you're processing, come back, we'll go through it and reenact it through this just phenomenal center that we have. So I'll stop there. That's kind of an overview of, again, many things that are going on. And let me see what the next slide is, Liz. Yeah, perfect. One of the things that I talked about is the support that you get. It's really unprecedented. You have like 3 different advisors, and it's all really coordinated and starts with Morgan. So I'm going to just hand it off to Morgan, and what she's doing is just phenomenal. So Morgan, take it away.
Thank you, Kyle. Greetings. My name is Morgan Rayner. I am the Health Professions Advisor here at PC. Liz, if you wouldn't mind moving to the next slide. So as Kyle shared, I am part of a collaborative support system for students here at PC within the School of Nursing and beyond. All students on campus do have an assigned academic advisor that either comes through a role of a staff advisor or faculty advisor. Throughout your time here, you will likely work with both. And I am a full-time health professions advisor. So I am in support of all students at Providence College who are interested in pursuing a career in the health professions. And that is regardless of the academic major. I will be physically housed within the School of Nursing and Health Sciences. So I will be directly centered in the advisement suite, along with your advising resources and additional supports on campus within the School of Nursing and Health Sciences when the new building comes up. And in addition to your academic advisor, I am providing support and coaching from your first year through your time as an undergraduate student and into your time as an alumni, depending on what your needs are. So I like to say that I am in addition to and in collaboration with your academic advisement structure. I am working with students on a one-on-one basis, but in direct contact with their assigned academic advisor to help identify which coursework students may need to be taking to ensure that they're meeting both or their core requirements, you are meeting your academic requirements assigned by your major, and you're also hitting any prerequisites that may be required for future education in the pursuit that you are selecting. I also am offering group advisement sessions as well as drop-in hours. So students, whether they have a quick question, long question, or want to work with their peers and having these conversations, I am available in supporting them as they pursue a career in the health professions. I'm also on campus and providing on-campus programming. I'm referring students to off-campus programming as well, as there are a number of really strong networks within the local community, and bringing some of those networks to campus here at PC within the School of Nursing and beyond. And then also, so in your first year, I may be speaking with you about what your goals are, where you may be pursuing your next steps, looking at different career fields, determining which direction you want to go. Moving into your sophomore and junior year, we're talking about course selection, preparation steps that you could be taking, and then eventually into your junior, senior, and after as an alumni, working with you to provide application support. So I am a service to all students at PC. That would be you if you select to come join us in the School of Nursing and Health Sciences. And I'm an additional resource beyond the typical advisement structure available. Kyle, do you have any additions that you'd like me to make?
I would just say, let's talk about health sciences just for a second.
Yes.
One of the things with health sciences is, I was just talking to a student about this today. There's so many different avenues that you can go. I think one of the common ones for our students, a lot of them have an interest in becoming a physician assistant. And when you look at what does a student need to do to go to PA school, I think the answer is it depends on which PA school, right? So now you can think students, it's like, oh, well, I'm interested in going to Connecticut, or I'm interested in going to California. You're going to have questions about what do I need to do? And I just want to put it in context, because that's where Morgan comes in. She kind of helps you navigate. But are you running into that, Morgan, where students are trying to kind of figure out, look, there's different prerequisites depending on where they want to go?
Exactly. I'm having conversations with students about, do they want to consider an ABSN program? Do they want to consider a direct entry NP program? Do they want to consider a PA program? So they are, one, exploring their careers, and then two, I also have students that I'm working with that have determined which career path they want to take. But now it's time to start looking at what prerequisites does that specific institution require, and also what clinical hours or exposure may be required to pursue that next step in education. And I am working on a one-on-one basis with students to create a plan, refer them to resources on campus and off campus to help connect them as they move forward through their time at Providence College so they can prepare for their graduate education.
Yeah. And we're in the process of hiring an academic advisor to work with you. And like you said, there's so many layers. It's almost like students, you get a team. You don't get an advisor, you get a team, and they all coordinate and kind of work. So on the nursing side of the house, your first kind of team member is you would be assigned one of our faculty. So Professor Amy Delaney, she's an award-winning nurse practitioner. She got Nurse Practitioner of the Year, I guess, in Massachusetts last year. She's her area is congenital heart disease. She works at Boston Children's Hospital and the Franciscan Hospital in Boston. And so if she's your advisor, you could go in and you'd speak with Professor Delaney, and she would kind of work with you, and you'd say, well, I'm interested in going into, whatever specialty. Then she could hand you off and say, look, okay, let's talk about this, but I want you to get another perspective. And she might, send you to Dr. Nancy Meadson, who's the chair of the department. Nancy has done amazing things. She's written a book on global health. She'll give you a different perspective. And then Morgan is here to kind of tie it all together. So again, that level of support, I just have not seen in my 30 years anywhere. And I think it's so important right now, students, because you have a lot of choices. I imagine you're really good students, or you probably wouldn't be on this call tonight. You're going to have choices to make, and you're going to have the world, is waiting for you, because we need you. And, I think, Morgan, I'll just, stop there, but you can tell I'm just excited that, we're in a position that we can give students that level of support.
Absolutely. Thank you, Kyle.
All right. So with that, we are kind of at the end of our presentation. I think we had one. Can we, Liz, throw up the last slide? Because Catherine has put on the ways that people can connect with us on Instagram and Twitter. I don't know. I think this works. If you guys take out your phones, I think you can get this through your screen, right? You can see how bad I am with social media. If it works, fantastic. But go ahead and, right now you can grab those and go ahead and follow us, because over the next month, as you guys are in the, the application and decision making, in the next couple of months in the spring, we're going to try to push stuff out to you so you can see what our students are doing, and, hear stories and get to know some of the people on campus. So go ahead and follow us. We love that. Go ahead and email us. I had one of the applicants from the health sciences program, a student I met at open house, said, go ahead, give me a call. We ended up having a one-on-one Zoom call this afternoon. If you're just 20 minutes checking in, we're very hands-on. Go ahead and, follow us, reach out to us. Someone will get in touch with you. We also work really closely with Liz. Our admission team is, if you've talked to our admission, I don't have to tell you how phenomenal they are. So they're a fantastic support for you as you have questions to figure out what you want to do. So yeah, I think that's it, Liz. We can take that down, maybe answer a couple questions, and let people kind of go enjoy their Tuesday night.
Perfect. And thank you both so very much, and for that kind little intro. I'm very proud to be part of the office I'm with. We do have a couple of questions that have come through at this point. A few that were tackled a little bit already, but ones that are definitely worth revisiting. So there is one asking, can we continue from RN to a PhD?
Yeah, well, there's actually, we do have, that's what our faculty, we have PhD nurses. I just mentioned Amy. Amy's just finishing her PhD at Boston College. But we have other faculty. Jill Waugh is finishing her DNP. So that's a doctorate in nursing practice. So on the nursing side, yes, PhD, DNP. Now, we don't have those programs in-house now, but again, we're going to start with an MSN and probably lead that directly to an NP, whether it's going to be a DNP, I'm not sure. But we will help you get there. And Jill Waugh is, Professor Waugh is actually an alum. She actually graduated in the business school, went back to school, got her nursing accelerated, and then is working on her DNP right now. So absolutely great question. The pathways are there. That's where Morgan comes in too, to make sure that, you know, we put you on those pathways. One other quick thing, because it reminded me, is we have alumni everywhere. We're heavy in the East Coast, like the New York hospitals, you know, you just walk down the hall, someone in there is a PC alum. And so again, so they've gone on, they've navigated, they've become, you know, NPs and DNPs and all of that. So it's not only here, remember, you're part of the Friar family. And what that means is we have an unbelievable network of friars out there.
Yeah, absolutely. And you referenced something that brings up another question quickly here. A student is interested in health sciences with a business minor. Is that something that can be accommodated? I am the biggest preacher of our liberal arts open curriculum. So if you want to just give that quick response there.
Oh, I don't know who asked that question, but just pat yourself on the back right now. The health sciences is built to have at least one minor, two minors, or a double major. That's fantastic. I personally love the combination of the health sciences with business. I actually think everyone needs business acumen. So yes, you can have a business minor, and yes, you should look. We have theater, dance minors, you know, as you said, Liz, right through the liberal arts. So highly encourage. It's built that way. There's so many electives in the health science major, you know, our major. Those electives, you can go deeper into a topic that you really enjoy within the school, or we encourage you to you know, take advantage of what's out there.
Right. The biggest question I'm seeing is asking what year clinicals will start.
Yeah,
and where
so
they will be.
our philosophy is the sooner the better. So your clinicals actually start your freshman year. And there's 6 weeks of clinicals in the second half of intro to professional nursing. Then it just keeps going. Sophomore year, I think you've got Med-Surg 1, and you know, you can look at the curriculum online, but we believe that you are excited, ready. We don't want to make you wait. That learning that you'll have in the field will make your time in the classroom even richer. So that, again, take a look at the curriculum. It's early and often.
Perfect. A couple of questions coming through asking about the accreditation process and how that will go through. Another one about the NCLEX passing rate, but both will be tackled together. So
yeah, let me take that one real quick too. Sorry, Morgan, I'm just getting fired up and I'm just rolling, but you jump in anytime. So accreditation happens, it'll be, let's see, your junior year. So we're a fully approved program by the state of Rhode Island. So I got to get this right. The State Board of Nurse Registration and Nursing Education. And that's what allows you to sit for the NCLEX immediately. Like, that's done. We couldn't even go call ourselves a program or accept students until we had approval. So we had unanimous approval, which almost never happens. 0 changes in our 100-page application. In other words, we call that a slam dunk. So we're a fully approved program. Accreditation happens once you actually have students and you have outcomes related to the courses and that type of thing. Every program has to go up for accreditation every few years. So whether you've been around for 50 years, like Georgetown, or whether you're a new program like us, everyone is constantly in a process of accreditation. For us, I think it's 2 more years before we would be accredited. But
Great,
again,
thank
want to
you.
emphasize, does not affect you as a practicing licensed nurse. That is an approved program. We already are an approved program.
Great. Two questions about study abroad opportunities, and you touched upon the programs there, but do you mind just repeating that piece of it?
I don't know if I missed anything, Morgan. I know you're new too. If you want to add anything, feel free. So we have study abroad, which is a semester-long experience, and nursing a little bit more challenging no matter which program you go to, because there's less electives, where health sciences has more. The way we've embedded that is, again, we've created Maymesters, which are 6-week experiences right at the end of the spring term, and students seem to love that option. Doesn't mean we're not going to do full semester long, but we're going to really load up on alternate spring break, Maymester, so you'll have multiple choices to have an international global experience.
Perfect. And I will take my counselor hat off and put my alumna hat back on. Our Maymester opportunities are phenomenal. I had the chance to do one too during my 4 years. It's such a unique way of having that true study abroad experience, but not having to take out as much chunk of a time during your experience. So
What did
it's
you do?
really great. I'm sorry.
What did you do?
Oh, I took a course called Roman Britain and Early Christian Ireland, A Clash of Two Cultures. So
Wow.
7 days in Ireland, 7 days in, or excuse me, 5 days in England, new city every night. It was a phenomenal opportunity.
We
So a
have
little more history focused.
yeah, we have Civ in Rome. That's
Mhm.
happening right now, like literally right now, although it's probably like 3 in the morning where they are. And so yeah, that's a good point. In addition, there's other types of these kind of shorter experience.
Absolutely. One student is asking if Boston Children's Hospital is one of the hospitals that clinicals will be done.
I think so. We haven't signed anything official, but again, that's where Amy is, and Amy will be taking her students there. Yeah, it's funny though. Everyone wants to go to Boston. I love Boston. I spent 20 years in Boston. I was at Dana-Farber, the MGH Children's. What we've learned, and I started another program, once you've experienced the parking, the travel, the logistics, and the experiences that you're going to get there are going to be sometimes not even the same here, because you may get more hands-on. So we have Hasbro Children's Hospital, which is like 2 miles from campus. Women and Infants Hospital is actually nationally ranked for maternal health, and the president of that hospital is a PC alum. That's like a baseball throw from where we're sitting. So yes, we will have the opportunity to have experiences throughout Boston. I think that's really important. New York, same thing, Hospital for Special Surgery, Sloan Kettering. But I will guarantee you our students are going to say, that's nice. I think I'm going to go to Women and Infants, and the Miriam Hospital is nationally ranked in nursing. So we got a lot right here within a mile, 2 miles.
Yeah. There's a couple of admission questions that I'm just going to answer quickly. A student asking for our early action applicants. So any of our students who have applied to Providence already through early action with a November 1st deadline, you will hear back from our office by January 1st. With your admission decision, all of that will be released through your portal, but you'll get an email from our office notifying you when specifically that information will all be released. And then there are 2 other questions asking the average SAT, GPA, and acceptance rate kind of things. I am happy to answer them, but I do also want to just point out that last year's or the current freshman class, last admission cycle that we were recruiting for, we were looking to enroll 50 students, whereas this coming class, we're looking for 75. So with that, numbers just are going to look different. But the SAT piece is a little easier just because we are still test optional for our nursing students as well, as we are with every single major. Last year, about 70% of our applicants did not submit SAT or ACT scores. So we can kind of push that one off a little bit. Acceptance rate for nursing was right around 32%. But again, take it with such a grain of salt. We don't know yet what this number is going to look like this year, because that enrollment number is going to look a little different. So I apologize for not the perfect answers on those, but want to make sure that we can keep moving along here.
Hey Liz, can I just
Please.
jump in on that?
Yeah.
What I've experienced my first year working with you, your team at admission too, is I think there was such an enormous influx for early action and early decision. And then I think it kind of sprinkled through after that, but I think most of the class kind of got filled. So take it for what it's worth. You still have a week, but early action, early decision there's some advantage there. Not sure that the admit rate, I mean, that's not my area, but I can tell you we filled most of our class in that early go round.
Yeah, it also just comes from percentage basis of more students are getting in because we have more applicants then. But there's another question about when early decision applicants will find out. You all will hear, if you apply through early decision, that binding process by December 1st. So a little bit quicker of a turnaround, but again, just a slightly different admission review process there. Another question asking, are there particular requirements for summer clinical work?
No, there aren't. In fact, we're working on a number of, we want to be a 12-month program where students who want to stay and, live in an air-conditioned dorm or their townhouse or their apartment have the opportunity to do summer clinicals. So that's something we built into the program.
Great. And then do you have nurses with different areas of expertise helping and teaching students with their clinicals?
We do. We've got everything from pediatrics to gerontology to med surge, and we're building. We're hiring every year. We're attracting nurses from around the country. They want to be part of this. I am so proud of our nursing faculty, but I got to tell you, on the health sciences side, it's equally as impressive. We just hired two from the University of Oregon. Really, really impressive in terms of our faculty.
Awesome. Thank you. The one final thing here, I actually don't know the answer to this one, but asking, I know the general response about cars on campus for students, but is there any difference from nursing perspective of students getting to their clinicals and how that transportation will work?
Yeah, Morgan, I have an answer, but I don't know. Have you run into this?
Not within the nursing student population, Kyle.
Yeah. Parking on campus is a premium. So we have student teachers in education who also go out, do their student teaching, that type of thing. Almost all of our students are out, they're doing internships and from the business school. It's a very active. So we have transportation options to get you where you need to go. I would admit that we need more options and we have more work to do. As far as, I think it's a lottery junior year than all seniors can have because seniors live off campus. But I think freshman, sophomore year, we're going to be using vans and things that are kind of like athletics does, although our athletic program, but when they have to play Bryant, you know what I mean? When it's close by, that type of shuttle service during the early years.
Thanks for referencing the education department, because that was the direction I would have taken. We do bus our students for their student teaching placements those first 2 years, because you're usually going as a cohort together. And then when you're more one-on-one student teaching, you have that car opportunity. So I anticipated nursing to look similar.
That's right, Liz. That's the same with nursing. You wouldn't be going alone. You'd be going with, we generally want 6 together, maybe 8. But that's as big as a cohort would go to one place. And then when you're seniors or capstone, you can kind of pick that's the time you might want to go to Children's in Boston or do something different. Those are kind of one-on-ones. And then when you're senior, then you have your car. So it's really not an issue, but I'm not going to say that it's easy. Transportation in New England is not easy, no matter where you are.
So that kind of sparked a few questions about student housing on campus. Housing is guaranteed and required for 3 years on campus. Our seniors do have the option to move off. If you would like to stay on for that 4th year, our students have been able to because of the percentage who choose to move off campus. So not a requirement, but the majority do choose that option their senior year. But for the first 3 years, freshman year is a traditional residence hall setting. Sophomore year is typically a suite style building. Junior is typically an apartment on campus. So you kind of do move up in independence sort of throughout the years. And then a student asked if the student dorms are near the new nursing and health sciences building. We are a pretty integrated campus, so all of the dorms are kind of amongst the academic buildings. It's not all dorms over here and all academic over here. So technically the answer is yes, but first year housing a little less so right next to that building. I hope that helped answer those 2 questions there. As we start to wrap up, go ahead.
No, I was going to say you didn't give a plug for like Hotel Shanley.
Yes, Hotel Shanley. I would truthfully live in Hotel Shanley.
Yeah.
It is our newest suite style building, Shanley Hall, which is closer to where the new nursing and health science building is going. It just opened up this fall as well. So one of our other brand new spaces, which is really great. So very excited about that piece of it. But as we do start to wrap up, I do want to thank the both of you for joining me this evening and for all of our students who took time out of their Tuesday night to join us tonight as well. This recording will be available on our YouTube page moving forward. And if there are other questions that start to filter through here, I will be sure to follow up with each of you with a response to those questions. But thank you both for joining me this evening. Any parting words of wisdom for our prospective students here?
You want to go first, Morgan?
Okay. I send you best wishes, and I'm hopeful that you come to join us with the School of Nursing and Health Sciences at PC. Kyle said, there is a great deal of excitement on campus, and it is growing. The support is there for you, and we hope that you come to join us. I hope to find you in my office one day.
Yeah, ditto. I would say this: enjoy your senior year. Just don't rush this. I know it's stressful. I put 3 kids through college. I get it, but you will be where you're supposed to be. It will work out. Take care of your health, your mental health, your physical health, your spiritual health, and we hope that we will see you as friars. But we're wherever you end up, just take care of yourself, take care of others, and it will work out.
Absolutely. I echo exactly what the 2 of you just said. For all of the students from my personal territory, I am excited to see your names coming through tonight. But every single one of you has a dedicated person in our office specifically for you. Reach out to us. We are here to help make this process go as smooth as possible for each of you, but excited to work with you all over the next few weeks and months, and wish you all the best of luck with the college process.
All right,
Thank you,
go
everyone.
Friars.
Good night and go
All
Friars.
right, bye, everyone.